Dr. Swetnam, what are the causes and treatments for venous disease?
Well, there can be multiple causes for venous disease. The overwhelming majority of the time it's caused by hereditary issues. So if your grandmother, grandfather, mother, father, brother, sister, anybody in your, in the lineage of your family tree that has significant vein problems, then there's a fairly good chance that you will have it too. Other causes are things that happen. Trauma can cause it. If you are in a motorcycle accident, say, and have both bone fracture of the lower extremities where the veins are actually damaged, that can cause it. Any other kind of trauma that causes a bad fracture in the leg or damage to the vein itself. And probably the third most common thing is deep vein thrombosis, where you get clots in the legs if you're hospitalized, things like that. Those are probably the three biggest ones.
What about pregnancy?
Pregnancy, generally, the old things that people used to say were, oh, I walked on a hard floor my whole life, had 4 kids, and those kind of things. Those can accelerate the problem. Most of those people start out with a hereditary etiology for their vein problem, and then it's accelerated by multiple pregnancies, walking on hard floors, things like that.
And the treatments?
Treatments are the same for pretty much all of them. Of course, if you have chronic deep vein thrombosis, you may need something else to treat it. And it all depends on your diagnosis. I mean, if you do ultrasound well, hopefully you can segmentally treat the problem veins. And in trauma and things, when people have both bone fractures in their lower extremities, it may not be exactly treatable because it may be a problem with the bigger veins.
And does that require a hospital stay?
If we can treat it, no. If it does require the bigger vein treatment of the larger veins in the lower extremity, there's really not a very good way to treat them. There's not really a good surgical procedure to help them. So most of those people get anticoagulation and compression therapy, things of that nature, instead of some type of surgical.